Welcome. Today we are going to look at the anatomy of the temporomandibular joints. TMJ is the name, the temporomandibular joint. If you open your mouth and close, you will feel the movement of bones just by the side of your ear, and that is the temporomandibular joint. Now, when you come across this joint, it looks as if it's difficult to describe, but let me give you just simple tips on how to do this. Number one, know the location. Where is it located? It's just located by the side of the ear, by the tragus. This is the tragus, this swelling of the ear. Two, how is the articulation fixed? Now, it is joined by three structures. One, mandibular fossa. Two, the articular tubercle of the temporal bone coming from up. And then, from below, you have the angle of the mandible. Importantly, you've known the location, you've known the articular surface. What are the articulating structures? Now, it's important to know that the articulating structures are the fibrous capsule that surrounds the articulating surfaces or edge. Two, you have the ligaments, of course, that supports. Of course, these ligaments also gives strength. What are some of these ligaments? We have the lateral ligaments. You have the stylomandibular ligaments. You have the phenomandibular ligaments. These are strong ligaments. Again, you also have an articular disc that gives support to this joint. You can also talk about more factors that give support to this joint. Of course, the position of this joint. It is occlusal in position, hidden. Another thing that gives support are the muscles. And what are those muscles? Muscles of mastication. The temporalis, the masseter, the pterygoid, lateral and medial pterygoids. It's important when you are talking about this joint. You've known the location, you've known the articulating structures. Of course, you've known the stabilizing factors. What are the muscles? I've mentioned that the muscles are important. One of the muscles, like I said, are the muscles of mastication. Know that. And what are the movements? You must know their movements. The movement here are many. Number one, you open your mouth. That's elevation. What are the muscles responsible? Temporalis, the masseter, medial pterygoid. You now talk of depression. When you bring down your mouth, of course, what muscles are responsible? You talk of masseter. You can also talk of lateral pterygoid. Now, when you talk of protraction, you move in your mouth forward. Of course, that takes you back again to the temporalis. Of course, that talks about the medial and lateral pterygoid of both. And when you're talking about side-to-side movement, you're chewing. Again, that takes you to lateral and medial pterygoid muscles. Now, what about the arteries of this joint? The arteries of these joints are basically from the superior temporal artery, the deep auricular artery. Of course, and their corresponding veins. What about the nerves? The nerves of this joint is very simple. Talking about part of the auricular branches of the mandibular nerve. The optic ganglion is part of it. The ciliary cervical ganglion is part of the nerves that innervates this joint. Don't forget to talk about the clinical anatomy of this joint. What is clinical anatomy? Temporal arthritis, otherwise known as locked jaw. You find it difficult to open your mouth as if it's stiff. That is temporal arthritis. Another clinical significance of this joint is what is called temporal derangement. This could happen when probably there is a forceful blow on your joint when you are looking for trouble. That blow will actually shift the joints, the articulating structures, and then you won't be able to actually chew or close the mouth very well until it has been pushed or remedied through some form of support. I think with this, you should be able to actually describe the temporomandibular joint known as TMJ in brief. Thank you. If you find this useful, then share and ask us your questions.